Nursing in the 21st century is the glue that holds a patient's healthcare journey together. Wherever there is someone in need of care, nurses work tirelessly to identify and protect the needs of the individual. Beyond the time-honored reputation for compassion and dedication lies a highly specialized profession which is constantly evolving to address the needs of society. In fact, nurses are indispensable in safeguarding public health. It is therefore not surprising that in many parts of the world, Nigeria included, many nurses have paid the supreme price on the front lines of the ongoing fight against the coronavirus pandemic. It is for reasons like this that May 12th is set aside each year to mark the contributions of nurses to society. But how crucial is the role of nurses in healthcare delivery, especially during a pandemic like this? This, among others, is what we're about to find out. Welcome to Nigeria Today. I am Dennis Adegnoye. All right, joining me on the program to discuss this topic is the General Secretary, National Association of Nigerian Nurses and Midwives, in person of Comrade Shettima Ahmed Thomas. You're very welcome to Nigeria Today.
Thank you for having me.
All right. And also joining us on the program is Elizabeth Ihetuge, Deputy Chief Matron, Alliance Hospital, Abuja. Thanks for joining us on the program as well.
Thank you for having me.
All right. Both of you, very welcome. All right. Our first guest, Shettima, Comrade Shettima, let me come to you first. We're in a global pandemic that is, of course, COVID-19, and no doubt nurses are on the front lines in this war, which is it is being described by many. Just to start off with, just tell us exactly what it means to you to be a nurse.
Well, thank you so much. I think this is a situation that is very difficult to describe because all over the world was not ready for this pandemic, Nigeria inclusive. Unfortunately, here we find ourselves. It is indeed very, very pathetic and very, very undesirable to pass through this situation. Nurses and other health workers in this fight against COVID-19 is actually having some issues. And the issue is already our healthcare system is something to talk about, although we might not be able to dwell on it today. But exactly, there is an issue there that needs to be addressed.
Yeah.
And then we have, in addition of a problem, a pandemic of COVID-19, who has no cure, who does not know any boundary, doesn't respect any personality. This is a very big challenge. Well, we are grateful to God that as professionals, we've been able to key into the situation. If you look at it globally, it has not been easy with other countries, and certainly it is not easy with Nigeria. But we are glad that the government was able to make some preliminary provision of the equipments. We're talking about the PPEs for people to work with. Yeah, our members have been trained and they found themselves in the isolation centers, where it's no longer a news to say that we have many patients. In places like in Abuja here, we have the first center was the Abuja Teaching Hospital, Gogalada, and then the second one, I think, is Osokoro. And other centers are being opened up. Even today, I think the Doom was also opened up as a center. But what is important here is how to fight unseen enemy, because COVID-19 is an enemy that you cannot see, but it sees you. It means if you are a general, then you must devise all the means to discover that you defeat this coronavirus. And in doing so, the equipments that are required cannot be overemphasized. As we speak, I think there is the need for the government, as they are opening up centers, to again train health professionals, nurses inclusive, and then increase the number of testing centers. Because without reasonable number of people being tested, it will be very difficult for us to know our positions. If you observe, we are gradually moving, and we are moving fast in these days, especially after the lockdown. The figures keep on increasing.
Yeah, we'll come back to that point a little later in the program. I'm going to bring Elizabeth in here now. Obviously, you are in the height of the nursing profession. Just give us how your experiences are now as compared to how they've been prior to the evolution of COVID-19.
Okay, thank you very much. Before COVID-19, oftentimes you come to work, generally as a nurse, you come to work not knowing what to expect. You come to work, you don't have any idea as to what you're going to face when you come to work, so you just take the bull by the horn. But then with the advent of this COVID-19, now you have to juggle between trying as much as possible to make sure that you are in line, because you're supposed to be well kitted before you go ahead to carry what you're supposed to do, and try to protect yourself in as much as you do that, and also protect other people, because when you protect yourself properly, there is a limit in terms of spreading the virus from one person to the other. So oftentimes the experiences have changed as to from before the COVID to now that there is COVID.
In terms of the PPEs,
yes,
are
in
they
terms
adequate
of the PPEs
for
and
the
the
nurses?
fact that you're dealing with an infection that, just as he has said, does not have boundaries, or doesn't have any form of boundary.
Okay. What is the relationship between the nurse and the doctor in the hospital setup exactly? Just tell us how you both relate.
Okay, for now, the pandemic, doctors and nurses right from time have always have this Cold War, so to speak. Nobody haven't really come out openly to say, okay, this is, but then the pandemic has come to draw everybody together. We now have a common enemy.
Yeah, exactly.
So whatever it is that the nurses and the doctors have as regarding fighting for remuneration and all, everybody had to try to put everything aside to face this common enemy. And then we're grateful that at least this COVID has also come to bring out to highlight the pivotal role of the nurses rather in the profession, in the healthcare sector. And it has also come to know how important nurses are, and also to help, of course, every healthcare team come to play their own role in the care of the patients, but it has come to unify the healthcare team as a whole, and everybody tends to forget whatever it is that we had in the past to fight this virus that has come as an enemy to attack us. Until when this is over, then I believe this will give us an opportunity to come together and see that we actually need to work together rather than working against ourselves.
Absolutely. All right, Comrade Shettima, in your view, nurses, those in that profession being well appreciated enough with regards to how they have coped with what is quite an overwhelming burden in terms of facing this COVID-19?
Well, thank you so much. I think this is a very nice question. Before the COVID-19, nurses have had so many reasons to demand so many things from government, but in most cases, government will give deaf ears to their demand, pretending as if the role being played there is not well appreciated. But the advent of COVID-19, I think, has brought so many things to bear. Before now, you and I may be compelled to attend a hospital in the country, while other people will jet out to go and access health care. But with the COVID-19, I think it is the opposite. Both big and small, we are here facing it, not jetting out. And with that experience, I think the thinking of everybody, including the government and the governance, have changed. They see the need not only to remunerate the healthcare workers properly, but also to fix the hospitals, to fix our healthcare system. Before now, honestly speaking, the patronage was less, and there are factors to it. If we want to mention some, we can. Reason being that some people may feel not contented when they come to public hospitals, and it is not as if the people they are not working. They are working. but there are inhibiting factors that are causing the problem, such as a shortage of nurses, lack of equipment, lack of motivation.
Does that translate to how nurses treat patients? Because there are cases where patients and the general populace sometimes accuse nurses of maybe some kind of attitude when it comes to dealing with patients.
Yeah, well, I wouldn't say that nurses are angels, but I think I will also say that we need to look at it critically and see what is actually the cause of some of that behavior. Like now, if you have more than 4 patients or a ward to one person to take care of, and they have their patient relations, and then each patient relation will want you to come and attend to his or her patient, because that is what they know. They don't know the assessment, which one will come first. Yeah. But you as a professional, you'll be able to know who you are supposed to attend to first. While you are doing that, the other people will be very, very, very angry with you. And in that case, they may feel they have been neglected, and they will be dissatisfied with the services.
Sure.
So that is not to say they are not performing, but it is a conditional thing. And that's why we always call on the government to ensure that the global standard of nurse-patient relation should be adhered to by employing more hands. Like we are saying in this COVID, we were at the centers today, we look at it. If you look at even the numbers that are there, God forbid, if there is any epidemic more than what we are taking today, it's going to be an issue. But we pray that the way we are moving, we should be moving gradually and maybe decreasing the number. So the nurses are doing all they can to ensure that the citizens of this country have gotten the best nursing care, given the circumstances they found themselves.
All right, let me put that question to you, Elizabeth. Give us your take on the nurse-patient relationship or rapport, as it were, pre-COVID-19 and post, currently during COVID-19.
Okay, just as he has said, in Nigeria, actually, the nurse-to-patient ratio is actually higher than what it's supposed to be. Okay. The standard is to have 1 nurse to 4 patients. But if you go to a standard government hospital, in a time you use the medical ward as an example, you might have a bed of 30 patients and then have 2 nurses on duty. And then, you know, with that, you might not be able to satisfy everybody, just as he has said, because everybody will not understand that there is triage, where you have to, you know which condition comes first and who to take care of first before the others. Everybody, of course, I wouldn't really blame the patients as well, because they want to see themselves as though they are the only patients in the world. But you know that is not what it is. That's not feasible. So the nurse will try as much as possible to still do what she or he can actually do. But oftentimes there is it puts a little strain on the patient-nurse relationship. So that is basically one of the things that affects the rapport between the nurse and the patient. But now, before the COVID, well, patients, you could come and sit down with a patient, because we thought that the patient is a biopsychosocial being. So you try to put into consideration every part of that individual, both the spiritual aspect of the individual, the psychological aspect of the individual, while taking care of the patient. So before now, you could always sit down with a patient and try to, talk to the patient. If it's a patient that needs psychotherapy, you can sit down to give that. But with the presence of COVID-19 now, that is a bit hampered because of the nature of the infection and its means of transmission.
All right. Okay. We'll pause for a break here. The program is Nigeria Today, and our topic is nursing Nigeria out of COVID-19, hopefully. We'll be back shortly after this timeout. Do stay with us.
The number of the COVID-19 cases in Nigeria is increasing daily, with many more tests ongoing. The battle of testing, isolating, treating, and attending to the affected persons rests heavily on the shoulders of our health workers, constantly putting their lives on the line and at risk to contain this virus, save and protect the lives of millions of Nigerians. To these health workers, we at the Nigerian Television Authority, NTA, On behalf of millions of Nigerians, say a big thank you for all that you have done and are doing. To the security agencies enforcing the lockdown and every other frontliner, we say thank you for putting your lives on the line to save ours. There is no amount of words that can quantify our gratitude. Thank you. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
All right, welcome back to the program. If you're just joining us, it's Nigeria Today, and our topic is nursing. It is International Day of Nurses, and our specific focus is on nursing Nigeria out of COVID-19. And our guests are still with us, Comrade Shettima Ahmed Thomas, the General Secretary, National Association of Nigerian Nurses and Midwives, and Elizabeth Ihetuge, Deputy Chief Matron, Alliance Hospital, Abuja. All right, Comrade Shettima, can you give us an idea of how many, what has been the mortality rate with regards to nurses as this COVID-19 war continues?
Yeah, well, it is very unfortunate that in the course of the nurses trying to save life, they end up having their own loss. As we speak, we start with people who have been tested positive. The data are there by state, but I think we will mention the highest ones. As we speak, in Kano alone, we have about 18 nurses that tested positive. In Bauchi, we are having about 17 tested positive.
Wow.
Then we are having in Edo about 5. We have in Lagos, it was 5. I don't know if it has increased now. We can go on and on, but at least for now, the confirmed mortality are 2.
2, okay.
Yes, while others are still battling in the isolation centers. So we wish them very quick recovery so that they can join other nurses to do what they know how to do best.
Yeah, it's an unfortunate figure, but in comparison to other countries around the world, it is not as if Nigeria is standing out in terms of fatalities with regards to nurses.
Yeah, it's a fact. If you look at it globally, I think we have reason to thank God that our own is going at a slow pace.
Yeah.
And that is why we are calling on government and all meaning Nigerians to ensure that they make available all these kits so that we will not again have many infected in the future, not to talk of them dying. Because there is no magic to it. If you don't have these PPEs and you are interacting with patients, then you are likely going to contract it. And as a human being, your chances of surviving also is 50-50 like any other person. You see, the risk here is this. Before even these patients are identified, they will first go to general hospitals where they have no badge on the head to show that this is a COVID patient.
Yeah.
They will interact with these health professionals. And it is after some examination that they will be identified as COVID-19 patient. And before then, the harm has been done. So that's why we are calling for government to make available this PPE, not only to those in the isolation centers, but all health workers that have reasons to interact with patients, so that we can, one, curtail the spread, and then we can also save the life of our health professionals.
Sure.
They are from a family. As soon as you interact with the patient, you get back, you have your children that will want to say, Daddy, welcome, Daddy, welcome. And if you are not careful, you have taken maybe the measures before you get home, you carry some gifts that are unwanted gift back home. God forbid. But I think we will rely on government. We have seen them as they are being serious to make available
the
those
PPEs.
things.
All right, Elizabeth, the theme for this year's commemoration is Nurses, a Voice to Lead, Nursing the World to Health. In your opinion, how are the nurses nursing Nigeria back from COVID-19? If you can give us your take on that war.
Okay. Sorry, I may have
How are the nurses in their efforts to nurse the country back to good health in the face of a global pandemic. How well do you think the nurses are doing?
Well, the nurses are doing absolutely. They are doing very well, because just as I've said before, that nurses, they have a pivotal role in the care of patients. Yeah. They are the ones that spend 24 hours. They are the only healthcare professional that spend 24 hours with the patient. So with this, they can help to ameliorate the rates of they help actually to speed the rate of recovery of these individuals, and also help in their own little way to curb the spread. The role of nurses is not just about the health care of patients. Nurses' role cuts across education, which also helps to sensitize individuals on how to curb the spread of this infection. Nurses' role cuts across advocacy as well as also, which also helps to advocate and also help the families of these individuals. Because when you are nursing this individual, because most of them are stigmatized, especially those that are already positive. And it's because of this stigma that individuals come into the hospital not wanting you to know that they have been exposed to an individual that has been confirmed positive, and then helping the spread. So the nurses come in to help individuals come out of this psychological trauma that they are in, and help the trauma also, because it's not just enough for an individual to be well physically. Emotionally and mentally, that individual needs to recuperate as well. Yeah, so nurses help to bring this individual stable, so that at the end of COVID, we will not have people that are impaired mentally or psychologically.
Which could be even more counterproductive. All right, comrade, there are reports that nurses are being attacked, shall we say, in isolation centers. How much credence can we give to that, and what can you say about it?
Yes, there are those reports, but we only consider them as the hazard of the job. You see, it all boils down to an education. While you are trying to put in your best in one hand, and some other person is looking at it as if you are not even doing anything, you are not only putting in your best, but you are giving out your life.
Yep.
Let me tell you that there are some people that resign their appointments in the midst of this COVID-19 in other countries. And there are people who believe that when others are running away from this, there's no way I can get there. But you, as a nurse who had signed to do this work, either dead or alive, you don't have to run away. And even in the midst of being attacked, I think the best we can do, though we are human beings, subject to reaction, but I think the best we can do under the circumstances is to look at it as if the person is not well informed of what you are doing. If he or she is properly informed, instead of even attacking you, I think he should be thanking you for what you are doing. But we are not deterred.
Yeah.
The nurses will continue to do what they know how to do best. We'll continue to render the services to the Nigerian citizens until we're able to do away with this COVID-19.
Absolutely. All right, Elizabeth, just give us your final thoughts, your words of encouragement and advice to your fellow colleagues and to Nigerians in general.
Okay. To the nurses, I want us to continue what we're doing and continue improving ourselves as we go. In as much as we might feel like we are underappreciated, or whatever we do is not really recognized, but we'll continue doing what we're doing, because for some of us is a calling, and oftentimes is even if most of us are passionate about the care of patients and seeing our patients recover. In as much as we do that, also we should try to take care of ourselves. Also, make sure that we use the PPEs and maintain the normal hygiene, because it's only when you are healthy that you can't give what you don't have. When you are healthy, if you protect yourself properly, you'll be able to render care and protect individuals also. When you take care of yourself, you'll be able to take care of the patients the way they are supposed to. Sure. Also, and to work towards a kind of dissipating the misconceptions that there are already on ground concerning nursing. There's a lot of stereotype that is around, so all of us should put our hands together to make this stereotype go away, to make nursing better than it was in yesteryears. And also to Nigerians, nurses are our friends. when a nurse corrects you, she's there it's for your own safety, because oftentimes now, okay, you come to a hospital, you are like, most people want to visit their relatives, and like, please, for your safety, limit the way you come to the hospital. If you ordinarily are supposed to be 5 to come and see a patient, one person can come. You can always place a call across to this person to show that you are concerned. When that nurse tries to tell you, please go home, stay at home, it is for your safety and for the safety of the person you are visiting as well. So let us try to appreciate the work of nurses, and then, well, by God's grace, we'll pull through.
Sure. All right, Elizabeth Ihituge, Deputy Chief Matron, Alliance Hospital, Abuja. Many thanks for sharing your thoughts with us on International Nursing Day.
Thank you.
And thanks also to Comrade Shetima Ahmed Thomas, General Secretary, National Association of Nigerian Nurses and Midwives. Thanks for also being with us and sharing your expertise on this topic.
It's my pleasure.
And we certainly wish you well, all nurses out there, as you continue to be on the front lines in this global war against COVID-19. That's how far we can go on Nigeria Today. Many thanks for watching. I'm Dennis Adigunloye.